Now, the Health Department says it's concluded the process of allocating medical interns and community service applicants for the 2024 mid-year cycle of the internship and community service program. Now, this program starts in July and is meant to manage the placement of applicants who could not be allocated at the beginning of the year because of pending academic results or incomplete modules. The department says 885 eligible health professionals, including medical doctors, nurses and pharmacists, have been placed. Chief Director of Human Resources at the National Department of Health, Dr. Luvuyo Bayeni, joins us now to expand on this. Dr. Bayeni, very good evening to you. Thank you so much for your time. You've now concluded this entire process. Perhaps let's talk a little bit about how it worked in terms of allocation and criteria.
Thank you very much for allowing us the opportunity to share and enlighten the community of South Africa. For one, we also want to acknowledge that the actual allocation for our internship and community service ideally should have been for January placements to cover for the whole year. However, as you have alluded to it, that we do have applicants that might have some various reasons, ranging from the academic cycles, also to the qualifications or the board examinations, as well as other reasons maybe that might be personal, varying from pregnancy and other health-related issues that will make them not being able to complete on time and to assume during January. So the placements in June, we refer to them as mid-cycle, which was just an effort for us from the department to show some caring element that some of these professionals would not necessarily have to wait the full year before they could assume duty. And as a result, we then do invite them to participate and apply, and then the system will then allocate them. So with this round, we have then since opened and asked them to apply as early as May. We have been in constant communication with them, outlining exactly the plans in terms of how the distribution and the allocation is going to work. And we are quite happy to be announcing, as you have alluded, that we can safely say about 885 of them have already received confirmation that they have been successfully placed, and most of them have also received contact from their employers in the form of the provincial offices and the facilities that they have been placed at and will be assuming duty because they have already completed this other process of the placements.
Dr. Bayeni, you'll agree with me that South Africa is grappling with a critical shortage when it comes to medical professionals in state-owned hospitals, nurses, and over 800 qualified doctors are unemployed. And all of this boils down to budget constraints. How are you going to navigate around that? Because it's all well and good to have these internships, have community service, but when the community service ends, what happens to these professionals who are now ready for the world of work?
I'm excited with the question because just as early as last week, we convened our National Human Resources Committee, which is the NHRC, which is having attendance from provinces. And amongst the issues we had raised when we were giving them a report of the placements was exactly that point, to say it is not enough for us to just focus on the statutory placements, which is the ICSP. When we don't plan in advance, when we don't communicate in advance what's going to happen post community service placements. And as a result, we have already, in planning for the 2025 January uptake, agreed with the provinces that by early as October, we should be able to communicate something that is concrete, not only to the health professionals, but also to the communities. Where we might identify shortfalls, we need to not sit on them, but we need to be coming up and clarify exactly what those shortfalls will be and what the implications would be in terms of the distribution of the healthcare workforce. Of course, you're right. Everything now revolves around how are we managing the resources that we have, especially financial or budget resources thereof. And we are optimistic that we would be able to try and find lasting solutions, because it is also not justified that every year we have to seem or look as if we have not been aware or did not understand our own throughput in terms of the number of the candidates that will be completing ComServe.
Yeah, because it's very discouraging. I mean, just in May of this year, we saw over 200 qualified unemployed doctors in the Eastern Cape, holding a protest and The protest was not even the beginning or the start of it, because it had also happened in February of this year. And one of the complaints that came out of this, deliberation, as we spoke to some of the doctors who had staged this sit-in protest, was that there is a release of block adverts, and when you go to the hospital to inquire about the positions, you're told that the positions don't exist. And the doctors were saying to us here at SABC News that perhaps all it is a show to impress the public of posts that don't really exist, without the necessary budget for their existence even to begin with, which is very discouraging and leaves them feeling hopeless.
Well, I think we have also learned a couple of lessons, and you are right to say there has been some expression in terms of the disappointments and as well as the loss of faith in terms of what government is trying to say or offer. However, I can assure you that indeed the issue of the block adverts, which was a provincial issue, initially when it was introduced, it was actually trying to get close to reducing the time that it has been taking to process applications as well as recruitment. And indeed, at the time it would have gone out, there was a projection of posts that would have been available. But of course, the limitation with the block advert is that its initial intention is for it to last longer, but the challenge with it might be when you come at the 9th month or the 12th month of that advert, you would find that some of the posts have already been utilized, and indeed it would not be an untruth when they tell you that the posts are not available at the time. So that is the limitation which we have picked up, and hence this time around we had then said and instructed provinces, as we were parting on Friday, to say, go back to your provinces, go look at your post lists, go look at your projections, and we would be expecting then when we meet in our next meeting before the October session, we will then be having ideal projections from provinces to say, in our space, this is where we think we'll be securing some funding, including some savings that we would like to realize within the current financial fiscus, especially when it comes to areas where we see a need for us to improve our efficiencies in terms of the current processes and practices.
What's also been highlighted, I think this was highlighted by the South African Medical Association, is the lack of public sector posts for newly qualified doctors. That in itself is also a massive challenge. How are you going to tackle that?
I think maybe let's also try and support the current situation with reflecting a bit on numbers, because of course our throughput is based on those who complete the community services, and we can project that there has been a shift in terms of creating quite a number of posts for us, especially if you reflect from 2016 up to date. In 2016 we had a throughput of about 1,322 community services medical officer, but if you look at your 2024, you are looking at about 2,374, which on its own, it's about 80% increase from the previous time. So we had to then adjust and balance to say, from those community services, how then do we absorb them in the system? Of course, it had to take a knock, because remember, the jump from the number that we are producing might not be what the provinces were used to in terms of absorbing and ensuring that there are posts that are available. So we do have that confirmation that indeed it had to then come to a point where we would then take a plateau in terms of the number of posts that are available, because we had managed to accommodate the previous jump of those numbers of thousands that we had been producing. The other issue that we have since looked into is to see how then can we make means and ensure that within the resources that are available, including the expenses that we are incurring on your committed overtime, your other allowances and benefits, to see how can we make use of that efficiencies and ensure that we can utilize some of those savings into securing funded posts that will be absorbing those that are qualifying. But what we are committed to is also not to try and mislead and assure people that they will be appointed into posts that are not funded, because equally so, that will create a problem for us. One, if we go ahead and force those issues, we would not be able to pay for them in terms of their salary at the end of the month. And even if we do find a way of doing that payment, it will also come back to haunt us in terms of the audit outcomes and the financial management of the organization. And we would not want to be the ones to be responsible for misleading, as well as leading the department into mismanagement of funds and irregularities thereof.
Yeah. Unfortunately, we're going to have to cut our conversation short, but let me thank you for your time, for speaking to us this evening. Chief Director of Human Resources at the National Department of Health there, Dr. Luvuyo Bayeni, speaking to us there and clarifying some of the plans that, of course, lie ahead for the new health minister.